Hi everybody, thanks for subscribing, thanks for watching, thanks for following us on Facebook and Instagram. Today we're going to be talking about fertility hysteroscopy. We've talked about fertility laparoscopy, and this is the second phase of how surgery may be beneficial to you who wants to have a baby. I'm Dr. Wanjiro Ndegwa, and you're watching Footsteps to Fertility. So, what's a hysteroscopy? Very simple word. Again, I'll cut it down. Hystero means uterus. So, hysterectomy, everything means uterus. So, we're going to be talking about hysteroscopy, which hystero is uterus, and scopy means we're looking inside the uterus. So, what this actually means is that we pass a tube that has a camera inside the birth canal and up into the uterus. It's very microscopic, by the way, and in that we're able to visualize the whole uterine cavity. And why is this important? It's because this is where the magic happens. This is where implantation occurs and where the baby grows. So it's really important that we see that this place is okay, and if there are problems, then we can correct it. So what are the reasons that we may want to take you in for a hysteroscopy? I think there's several reasons, but it's basically to find out if there's anything that is interfering with our implantation. Remember, fertilization has already occurred in the tube, and the little embryo that has formed has to go down, travel into the uterine cavity and implant. So it has to have blood vessels and it has to have some traction to actually implant into the endometrial tissue at the back of the uterus and therefore get blood supply and grow. So if we have fibroids inside the cavity, if we have polyps inside the cavity, if we have cysts, which are bags filled with fluid, or in some cases, if we have a septum. Now, what a septum is if the cavity has some thick wall dividing it, then obviously we're not going to conceive because it's taking up the space where our baby is supposed to be. So what hysteroscopy actually does, and why we do hysteroscopy, is we're able to solve all those problems. So if you have a fibroid, we're able to remove it and you can get pregnant. If you have polyps, and polyps, think about the things in the sea that actually look like what do they look like? Well, the things that look like ferns and something that you see in the sea, that's actually what we see inside the uterine cavity. And that obviously will not allow implantation. So if they're there, we can simply remove them as well. If you have a septum and that's that band that is there that will interfere with implantation, we're able to cut it away, and that helps as well. I'll also want to just talk briefly about having an MVA. What an MVA is, and some of you have had this, is when you've had a miscarriage, we go in and remove the products that were left in. Sometimes this can happen and some of the layer comes out of the endometrium, or sometimes what happens is that you get infection after that, or even after a normal delivery or a CS. Sometimes the infection can occur, and that can be very bad for our uterus, and the layers can actually stick together. So another reason we could do a hysteroscopy is to separate those layers and actually give you space for the baby to implant. So hysteroscopy is a very, very important procedure. We also do it sometimes before IVF because it has been shown to have beneficial benefits for doing it before IVF. We see that sometimes the rates of implantation, rates of pregnancy are much, much higher after you do a hysteroscopy. So don't be afraid of hysteroscopy. It's really non-invasive. We go in right through the cervix, so there are no scars for hysteroscopy. It's really quite a simple surgery. It can be done in the office. Most fertility centers are able to do it because we also have a daycare, so we're able to do it. And it's not a very long procedure. Sometimes if we just want to diagnose and maybe just see, or for those people who we're doing it pre-IVF, it takes about 10 to maybe 30 minutes and we're done. So, and you go home. So it's not a big thing, but it can increase your chances of conception by a very huge margin. So I think I've gone through the benefits of why we do it. It really does enhance fertility, and if you have any of the things that are obstructing implantation, they're removed. And some clients just, all we do is remove those polyps, remove the fibroids, and 3 months later they're like, okay, I'm pregnant, and we didn't do really anything. So please never ignore simple things. Yeah. I hope you've enjoyed the video. I hope you keep watching. Please share with a friend. Please like, please follow, please subscribe. And the most important thing is I hope that I'm giving you hope. Yeah. So this is Dr. Wanjiru Ndagwa, and you're watching Footsteps to Fertility, where we walk with you.